An overview of today. We're going to go into more of like what is elevated blood sugars, what does that mean, pre-diabetes, diabetes. We're predominantly going to focus more on type 2 over type 1 diabetes, as that's what we tend to see more of in our clinic. And then we'll go more into the medication management and then finish with, of course, the nutritional management, as it's an interdisciplinary condition that involves both medication often and lifestyle management. We'll have a summary and a Q&A at the very end. So without further ado, let's begin. What is blood sugar? What does that mean? So our blood sugar is the most simplest form of a carbohydrate. So you'll hear the term blood sugar or glucose. It's two synonym terms overall. In general, it's an overview of the conditions that when conditions of blood sugar is dysregulated, you'll see hypoglycemia. So you'll see the image to the right, where that's indicating, you'll see with the platelets and the red blood cells, these small dots to indicate low blood sugar, right? So if we're going below 70 milligrams per deciliter as a diabetic, we want to make sure that we're above 70, but we want to try to get overall below 100 milligrams per deciliter in our fasting blood work, which we'll go more in depth later in the presentation on. You may hear the term hyperglycemia, so opposite of hyper is that we have elevated blood sugar. So elevated blood sugar can be above, like I was saying, 100 milligrams per deciliter for the general population. For a diabetic, over 126 for our fasting blood sugars. It's the primary source of energy that our body utilizes, and it derives from our carbohydrates. We'll go more into carbs, but carbs are more of like our fruits, our vegetables, our whole grains, our beans and legumes, but it can also be more of those refined white breads, white starches, sweets, etc. Just to be aware of. Just because some foods are carbs doesn't mean that they're the devil, however. Our blood is our transport system for our glucose, and it's going to transport it all throughout the body. As you'll see, when there's different abnormalities with blood glucose, we have to be cautious of certain other body systems that we'll get into later on. Diabetes arises which is a condition in which our blood sugar levels can go abnormally high due to not having enough insulin or having insulin resistance. Now, insulin resistance is where a lot of us tend to get a little stuck. So we're going to get a little sciencey at first right now because it's extremely important to go over. Stop me if you have questions, but this, I promise, it's not going to be like this the entire rest of the presentation. So let's go over first how blood sugar is metabolized so we understand what it's like when things are working well, so that we can understand what happens when things aren't working as well. So the food we eat, carbs, are broken down into sugar or glucose, right? The most simple form of a carb. Blood sugar enters your bloodstream, which signals the pancreas to release insulin. Insulin, it's a hormone. Its main job is responsible for helping the blood sugar or the glucose to enter the cells so it can be used for energy. So it's quite literally that key to unlock the cell so that sugar or glucose can enter the cell. And at that point, the cell is going to either utilize that glucose for energy to, go run, jump, do our regular daily activities, walking throughout the day, just to sustain life, or it can be used to, if we have excess, as storage for in the form of body fat. So insulin also signals the liver to store blood sugar and also muscle cells to store blood sugar for later use. Like I was saying earlier, if we don't use it, we'll store it. So with blood sugar enters the cells, the levels in the bloodstream begin to decrease signaling, and then therefore, as blood sugar decreases, insulin decreases. Lower insulin levels alert the liver to release the stored blood sugar. So when we're going a little low and not getting enough sugar, that's when our liver is going to say, okay, here's some to utilize now for energy, but also will store it for us as well. And if we don't have enough insulin or the lock mechanism, so insulin is the key that unlocks the cell. Now, if that lock is becoming jammed or it's not responding to the key, or the lock gets, say for the metaphor's sake, the locks get changed, right? And then it's hard for that cell to take in the blood sugar is going to start to accumulate, right? So that's what we call insulin resistance. So that's the big difference between type 1 and type 2 is type 1 diabetes is typically a lack of insulin, where type 2 or insulin resistance is more that the locks are getting changed and the keys are not unlocking the cell. So the blood sugar is not getting into the cell and then therefore it's accumulating up into the bloodstream, elevating our blood sugars overall. So this is something just to be very mindful of and considerate of when we're having carbohydrates. And this is why those in counseling, we talk about pairing and mitigating blood sugar spikes, is so that we can prevent that excess storage and so that we can best utilize our energy. So going forward, that insulin resistance, it occurs over a prolonged period of time. Sometimes it can be insidious. It's typical that people can have insulin resistance going on and then not have their blood sugars go above 100. So it is important to check in with our doctors about that. But today we're going to focus a lot more on prediabetes, which so that insidious insulin resistance has gone on for about 6 to 10 years potentially. And now we're leading to the prediabetes. The blood sugars are starting to go 101, 102, 105, 110, up to 120, 125. So approximately 1 in 3 Americans today have prediabetes, and 84% don't know they have it. So that's a big portion why we're touching upon it today, not just jump into diabetes, because if we can aim for prevention, why not? An ounce of prevention is worth a pound of cure. Adults and children with prediabetes are, of course, more likely for type 2 diabetes if they do not make lifestyle adjustments. And I know it might sound frightening or scary, but these adjustments can be, going for a walk in the afternoon or being different conscious things that we could talk about with our diet. Also, our sleep affects our blood sugars and our stress. Blood sugar is essentially a measure of stress on the body. So not always is it diet, not always is it one thing either, but we have to look at our sleep. Are we, if we're sick, it's going to raise blood sugars. If we're stressed, it can potentially raise blood sugars, as well as our diet. So we have to look at the entire lifestyle as a whole. When someone has prediabetes, their cells are not responding properly to insulin. So like I was saying, the locks are getting changed on us and we don't have the right key for the lock. To get the cells to respond, your pancreas has to produce a little bit more insulin. So now that pancreas is pumping a little bit extra. It's getting tired, pumping extra insulin. And when the pancreas can't keep up, or what's called those beta cells of the pancreas is what makes the sugar, and they start to burn out and die off, that's when a type 2 diabetic might need to start utilizing insulin because the insulin's trying to keep up with the locks that are getting changed, essentially. And that sets the stage for prediabetes. So I like to give a little overview of what is the condition that we're trying to manage. So diagnosis of prediabetes includes a fasting blood sugar above 100. We need 2 or more of the following to be confirmed with a diagnosis. You don't often see this second test done in clinical practice as much anymore, like the 2-hour plasma glucose test. So I'm going to kind of skip over that. But really, the A1C is that gold standard. And you may hear a lot about that hemoglobin A1C. We want to aim for under 5.7, but a prediabetes range is 5.7 to 6.4. And with that being said, your A1C is a measure of your glucose over 3 months. So as a lot can go on with a fasting blood sugar is just a pinpoint in that time period, a match of that second that we took the blood sugar, where the A1C, as you could see, is more of that gold standard. You don't have to be fasting for it, and it's an average of 3 months. So if prediabetes is not managed, it can manifest to type 2 diabetes, of course. So now it's just that greater accumulation of sugar in the bloodstream, that those locks are getting changed on a greater scale. And now the pancreas is working overtime to try to secrete that insulin. And now we might not be secreting enough insulin to do the job. There are various risk factors for diabetes, of course, prediabetes. If we are, it says overweight, BMI above 25, but I'm going to be really honest here. A BMI only can tell you so much, right? It's really just a height to weight ratio. What's the composition of that weight? Is it muscle? Is it fat? And of course, if we're a BMI of 35 and we have a ton of muscle on us, it's still a lot of tissue for that heart to have to pump through. But with that being said, we want to look more at the distribution of that tissue. Is it more body fat? And also, where is that fat held? Is it more along the waist circumference? Because that's really what we want to look towards, is that waist circumference, as it puts a lot of pressure on our organs. It can affect our airflow. So people with OSA or sleep apnea, GERD, I digress. But with that being said, it's more stress on the body. And that's more of what we want to look for if someone has a waist circumference, say above 35 inches as a female, 40 inches as a male, we're going to be at a greater risk. Of course, over time as we get older, things can sometimes change. So an age of 45 or older, if we have family history, if we're leading a more sedentary lifestyle, and of course, different races and ethnicities are at a greater risk due to their genetic profiles. For diagnosis of diabetes, two or more of the following confirm a diabetes diagnosis. So a fasting blood sugar above 126 or an A1C above 6.5% is typically used. And if our A1C is going above 7%, it's deemed that the blood sugar is out of control, or or the person is deemed in need of more frequent follow-ups with their endocrinologist. I do highly suggest, if someone is newly diagnosed with diabetes, to always work with a dietitian or especially a certified diabetes educator. And to know if someone's a certified diabetes educator, it will say it in their credentials after their name, CDE. But of course, speaking with your primary care physician or an endocrinologist is always one of the first steps. It is not a 9/11 related condition at this time, but with our nutrition department, we are that kind of funny workaround because the body is all linked, of course. So if you do have questions or concerns about your diet relating to your blood sugars, we are here for you guys, and we can help to work with you guys on lowering blood sugars. So again, like I was saying, these are the differences between type 2 and type 1 diabetes. Really, the root is that a type 1 diabetic, they just don't make insulin, really. Type 2 is more so that receptor. It's the locks getting changed. Why should we care? Okay, so why does it matter that my blood sugars are going high? What does that do? Aside from it makes us feel kind of crappy sometimes if our blood sugars are going high, lots of peaks and high peaks and low lows in terms of our energy, that mid-afternoon crash we may be feeling, but also from a more medical standpoint, cardiovascular disease, it's the leading cause of death in Americans. Also, diabetics are at a major increased risk for a heart attack or stroke. It's actually, a diabetic is 2 times more likely to have heart disease or stroke than someone without. Retinopathy, that may sound like a more complicated term, but it's really a loss of vision. Picture sugar. It's a crystalline picture, like a little shard of glass. Goes all throughout the body and our bloodstream, right? It can get into places. If it's getting into the blood vessels around the eye, it's going to affect the vision. It's going to cause more clouded vision. Same concept. If that blood sugar, that crystalline structure, is getting into the kidneys, which has to filter everything, right? Then it can affect our kidney functioning. So you'll see many diabetics that are uncontrolled long term, it can lead to chronic kidney disease. The peripheral neuropathy, autonomic neuropathy, it affects our nerves, whether it's damage to the nerves or numbness, that tingling in the hands and feet, that poor circulation feeling, right? But that can cause us to bump into things, stub our toe more likely, and then with that, we don't heal as quickly. If the blood sugars are high, we're more prone for infection because bacteria love sugar, like they want to feed off of it. So amputations, one of the leading causes of amputations is of course diabetes. The autonomic neuropathy, it's delayed stomach emptying. Sometimes we'll feel that dumping sensation in our gut as if the food just kind of fell into our small intestine or our large intestine. And it can potentially lead to loss of feeling in other areas of the body. So like I was saying with the feet and the hands, also on the level of our heart tissue. So that's why EMTs will say that diabetics sometimes have more silent heart attacks because they really they're not feeling it. So it's something to be very aware of. It's something that is preventable, something that if we are diagnosed, we are not our diagnosis. It does not define us, but it's something that we need to take control of, as it can spiral if it's not taken control of. And of course, heart disease is brain disease, right? So high blood pressure or cholesterol, that affects the brain, right? All that blood is also getting pumped through our brain. So it can lead to early onset cognitive decline as well. So, something to be aware of. So symptoms of diabetes, if we're noticing that we're really thirsty or always hungry, it's because that energy isn't getting into the cell to be utilized, right? It's filling up in the bloodstream. So we're super hungry, super thirsty because we need food. Believe it or not, when someone's about to get diagnosed with diabetes, typically there's an unexplained weight loss because the body is not getting that energy in. It's that quick 10 pounds. And you're like, why did I lose that? something to be, mindful of and aware of. It can also be weight gain related too. So just being conscious of taking a weekly weight, being mindful about it, or being mindful about how our clothing fits, just to know if there's any unforeseen changes without us having an intent to change those, the waist circumference or our weight. Changes in blood pressure, numbness in hands or feet, any dizziness, of course, elevated blood sugar, any sexual disorder, and the frequent urination is something to take note of, because if the sugar is building up in the bloodstream, our body is going to have to process it. So we become very thirsty as also a way of flushing that through the body, and then our body's racing to excrete it. So if the doctors ever called and said, hey, you got some glucose or sugar in the urine, it can mean that it's filling up in the bloodstream and needs to get passed through the urine because it's not getting absorbed into the cells. Like I was saying, eye damage or candida, which is a type of bacteria that feeds off sugar. We're going to go first into more the medication management. So now that we've gone over what is diabetes, prediabetes, the mechanism of action, Dr. Lila Mustafa is going to go into now how the medications play a role in it. And then we're going to do more of the nutrition and the lifestyle mechanisms. So Lila, without further ado.
Thank you, Amanda and Katie, for inviting me to participate in this webinar.
My pleasure.
So let me just start off by saying that this is a very large topic, and there's a lot of medications and variety of different treatment options available for the management of type 2 diabetes. So in the interest of time, I'm only going to be discussing the most commonly used agents. So you may be using something that I don't mention here. It doesn't mean that it's not appropriate. Next.
Sorry, I'm trying to get it to go. It's not. There we go. It's a little stubborn today, so I'll click for you.
So before I go into the medications, I just want to emphasize how important lifestyle modifications are in the treatment of diabetes. Although type 2 diabetes is a very complex condition, we know that it's largely controlled by what we eat, and that losing weight results in decreases in blood sugar. So this figure shows the treatment approach from the American Diabetes Association guidelines. As you can see, lifestyle modifications are the first line in the treatment and prevention of type 2 diabetes, meaning that if achieved, this can be the most effective. So the ADA recommends lifestyle modifications, including weight loss and increase in physical activity before the initiation of or in combination with the initiation of medication as the initial treatment. So you can also notice that lifestyle modifications is at every step of the treatment approach, meaning that even if you're started on medications, it doesn't mean that you should give up on trying to lose weight, making dietary changes, or exercising. In fact, weight loss can help medications work better, stay effective longer, as oftentimes medication efficacy can decrease over time. And it can also, and adding on certain medications can help to achieve weight loss sooner as well. Next. So Amanda kind of went over the different mechanisms of hyperglycemia. So I want to go into the medications, but I just wanted to review really quickly that diabetes, like I said, is a very complex mechanism, and the root of the hyperglycemia has is a cause of many different defects. So we call it the ominous octet because there's 8 different defects in the sugar metabolism process that leads to high blood sugars. Some of these include your pancreas, impaired pancreas, impaired insulin secretion by the pancreas, decreasing the decrease in the glucose uptake by the muscle and the fat tissue, as well as the increase of glucose production by the liver. So there's a lot of different factors that go into this, and the medications that we have available target each of these different areas. Ideally, we want to choose treatment regimens that target different areas so that you're correcting each one of these defects in order to get the best blood sugar control. Next.
Well, I love that you said that, because a lot of people, just to jump in real quick, will come to counseling and think that it's just one thing, like, oh, it's just their diet. And there's so many factors going in, and that's why it's a lifestyle change. Notice, guys, that we're saying lifestyle and not diet all throughout this presentation. So I just wanted to make sure we drove that home. I'm going to press next now.
Okay, so just to start going into the medications, the preferred initial treatment for type 2 diabetes is metformin. The brand name is Glucophage. It's an oldie but goodie. It's the most highly effective oral treatment that we have. It can lower your A1C by 1 to 2%. So what does it do? It decreases the amount of glucose that's produced by the liver. It also increases the peripheral uptake of the glucose and decreases the intestinal absorption of glucose. It typically targets the fasting blood sugar. And some pros and cons of this particular treatment is that it's weight neutral, meaning that it will neither increase nor decrease your weight. It doesn't cause hypoglycemia, so that decrease in your blood glucose, making you feel uneasy. It doesn't do that. It's an oral medication and it's very cheap. As far as the disadvantages, there's a lot of GI side effects associated with this particular medication. So nausea, vomiting, diarrhea, just upset stomach in general. So when or if you're starting on this medication, we typically recommend that you titrate up slowly. So it's typically given at 500 milligrams daily. It should be increased slowly by 500 milligrams every 7 days until you reach your target dosing. If you're taking the immediate release version, it's typically taken twice a day. If you're taking it more than one time a day, you take it with breakfast and with dinner. If you're on the extended release version, it's typically taken all at once with your largest meal of the day, typically in the evening. Just be mindful that the extended release or the ER formulation cannot be broken, chewed, or crushed. Either way, this should be taken with food. And if you are having the side effects of nausea, vomiting, and diarrhea, most of the time switching to the extended release version of this particular medication can help improve those symptoms. Also, taking it with food helps a lot. A lot of times, I don't think doctors mention this enough, that the GI side effects can improve over time. So just giving it some time to kind of work and allow your body to adjust to the medication is the best scenario. And the reason I say that is because once this medication is initiated, because of how efficacious this medication is and how well it works in reducing your A1C levels and your blood sugars, we want this medication to stay on board at all points of treatment. So once initiated, metformin should be continued as long as it can be tolerated and it's not contraindicated. Other agents are typically added to metformin, whether this is other oral medications or even insulin. So this is kind of our best oral medication therapy that we have. So we like to have patients stay on it if they can, as opposed to switching to other medications. And a lot of the reasons that people come off of this is because of GI intolerances, when there's ways around it or ways to improve those side effects.
Lila, what do you think about pairing it with Imodium for some people?
I've never heard of that before, but I think so. Imodium is not typically something that I would recommend. Imodium, so it's an antidiarrheal agent, so it helps with the diarrhea symptoms, but it's not something that should be taken on a regular basis.
So it might be something to use like in conjunction on an off day, but not every day for some people, right?
Correct. Yeah.
So that's excellent.
Because the other issue with Imodium is that it can actually mask the signs of like a viral infection. So if you were having something viral going on and having some diarrhea, you wouldn't know because the Imodium is suppressing that.
So I'm going to shift to next, but Lila, thank you. So that's super important for anybody taking Imodium every day with their metformin, that to maybe consider working with Lila or their endocrinologist on their medication regimen.
So the next class of medications is called sulfonylurea. So these are your glipizide, glimepiride, and glyburide. Next. I like to call this group of medications the pancreas squeezers because they work by increasing the amount of insulin that's released by the pancreas. They're also highly effective and super cheap. They're also taken orally. Some disadvantages of this particular group of medications is that they can cause weight gain. They do have a higher incidence of hypoglycemia. There's some possible risk of cardiovascular risk associated with it. But some counseling points to remember with these particular medications: if you're taking the immediate release version, it should be taken 30 minutes before meals. If you are not going to have a meal, then you should not take this medication. Otherwise, it can cause hypoglycemia, which is a drop in your blood sugar. And then there's extended release versions of these medications, which you would take regardless if you're going to be having that particular meal or not, because it's extended release. And you would take this with your first meal, preferably with breakfast or whatever your first meal of the day is. And glyburide is one of the medications that's in this class, is not recommended first line just because it does have the highest risk of hypoglycemia in this particular class of medications.
I want to point out too, we're going to send this PDF of the slides to anybody who's here today that wants it. So if you want the slides, just send me an email, because some of these may not apply to you, but some may, and Lila has to go quick. So it would be nice to let me know if you want a copy of the slides so you have them. Thanks.
All right. Keep in mind that in also the treatment of diabetes, we usually add on therapy. So it's a combination of medications to help you reach your treatment goals. And it's super important that if you are not tolerating medications or you're not using medications as prescribed, that you communicate this with your providers so that they're not thinking that you're using the medication when you're really not, and then they could just add on new medications when you're not really taking the ones that were previously prescribed. So the next class of medications is called the DPP4 inhibitors, and these are your Januvias and Glyza, those type of medications. They can be given alone in people who can't tolerate metformin, but they're typically added on. And the way these work is that they prevent the breakdown of the GLP-1 hormones, which we call the incretin hormones that promote insulin release from the pancreas. They have modest efficacy, some pros and cons. They're oral medications. They're well tolerated. They don't affect your weight, and they don't cause hypoglycemia. But some negatives of these is that they are expensive. They don't have any generics, so they're only brand name medications. Some side effects is there possibly risk of pancreatitis and reports of joint pain. They're taken once a day, and they can be taken without regard to food. The next group is called the thiazolidinediones, which is the Actos and Avandia. Avandia is not so much available in the market anymore because of its risk of cardiovascular and heart failure side effects, but Actos is. Next. The way these medications work is that they increase the body's sensitivity to insulin, they enhance the sugar removal from the bloodstream, and decrease insulin resistance. Some pros and cons: they're given orally, they don't cause hypoglycemia, but some cons is that they do cause weight gain, and like I said, they do have some side effects with impaired liver function and possible cause of congestive heart failure. Again, they don't have to be taken with regard to meals. However, these medications do take about 6 weeks to reach their maximal effect, so they do need time to see your results. The next group is called the SGLT2 inhibitors. So these are your Invokana, Farxiga, Jardiance. These are a newer class of medications. Again, they don't have any generics, so they're only brand name, which makes them more expensive. Next. And they work by blocking the reabsorption of glucose in the kidney and increasing the excretion of sugar in the urine. These are also pretty highly effective. Again, they're oral medications. The pro of this is that they do cause some weight loss and have a cardiovascular benefit. They also don't cause hypoglycemia. Some cons is that, again, high cost medications, there is an increased risk of yeast infections and UTIs, particularly in women, as well as some bone fractures and risk of amputation, specifically with the medication called Invokana or canagliflozin. These are once daily medications, preferably should be taken in the morning with the first meal of the day, but they don't have to be taken with regard to food. And again, these are a good choice for people with heart failure or chronic kidney disease because there has been shown to be some cardiovascular and renal benefits. That was the last class of oral medications. So now we're going to get to the injectables. And so this class of injectables is called the GLP-1 agonist. Again, it's a fairly new class of medications. These are not insulins, though. These are something that we call incretins, which is a separate type of hormone. So these are your Trulicities, Byetta, Victoza, and Ozempic. These can be dosed as weekly injections or daily injections. Next. So these hormones, again, they're not insulin, but they're a group of gut peptides that help release, that are released after eating and augment the secretion of insulin that's released from the pancreas. So it also helps slow digestion. So it reduces gastric emptying, which helps you feel fuller longer and suppresses appetite. So one of the benefits of these groups of medications is that it causes weight loss. Some cons is that it's an injectable medication that's injected under the skin subcutaneously. Because they're injectable, they're high-cost medications, and there are some GI intolerances associated with this medication as well. However, this group of medications does have those positive effects on cardiovascular benefit and kidney benefit as well. So they are recommended for patients with some of those risk factors. Next. So that covers the non-insulin products. Now we'll briefly review the insulin products. Again, there's so many different products, so I'll just cover the basics. And if you have questions, you can reach out to your providers. So insulin cannot be taken in a pill form. It's only available in subcutaneous injections. In the past, insulin treatments were reserved for patients with type 2 diabetes whose blood sugars was not under control with oral medications and lifestyle modifications. However, there's more evidence showing that insulin treatments at earlier stages can improve overall diabetes control and help to preserve the pancreas's ability to make insulin. So you shouldn't be concerned if the provider wants to start you on insulin. It's not the end all be all. It just means that the doctor wants to get you under control as quickly as possible, and insulin might be the quickest, most effective way. There's a lot of different products out there besides like the traditional vial and syringe. So now there's pre-filled pens, so that allows for easier injections, more convenience, and they're super tiny needles that are pretty painless and easy to use. So just some counseling points with injectables. Make sure that your injection sites are being rotated. So you typically should be injecting in either the thigh, the abdomen, or storage requirements for these types of insulin is it does have to be refrigerated when for unopened vials and pen needles. Once they're opened or you start using the particular vial or pen needle, you can store it at room temperature until the expiration. Again, you can there's very particular injection techniques and timing of administration that's associated with each type of insulin. Next.
Sorry, it's being a little sticky. I don't know why it's not going. There we go.
Okay. So again, then we just kind of there's a lot of different types of insulin, rapid acting, short acting, intermediate acting, and long acting. The important thing to note here is how quickly they start working. And the important thing to remember is when to take these medications in relation to your meal. So the rapid acting ones work within 10 to 15 minutes. So they need to be administered right before the meal or within 10 minutes of starting the meal. So if you're not going to have a meal, then you shouldn't be injecting with the rapid acting insulin. For example, if you use the insulin and you didn't eat, you're going to be at risk for hypoglycemia. So your blood sugars might drop to dangerous levels because you injected yourself with the insulin and didn't eat. And on the other hand, if you ate already and then you inject yourself with your insulin, it's not going to cover that those glucose readings, and so it's not going to have the your numbers might still be elevated post meal. So timing is super important with these particular insulins. The basal insulins are your kind of baseline insulin, so they give you a small amount of insulin throughout the day, and they're usually dosed once daily, typically at bedtime. So like I said, there's several types of insulin regimens, each tailored to each particular individual. I'm not going to go into detail as this can get very complicated, but if these regimens are initiated, they should be discussed in detail with your provider or diabetes educator to make sure you have a full understanding of the treatment. So which insulin you're using, how much insulin you're supposed to use, how often you're supposed to use the particular insulin. The main goal in designing any insulin regimen is to mimic how the body normally releases insulin. So typically that's like a basal bolus type of regimen. So basal meaning that you get a basal background dose of insulin throughout the day, and then bolus meaning that you get those bolus doses of insulin for those sugar spikes when you have your meals. Sliding scale is another type of regimen. So this involves measuring your blood sugar and then giving yourself an injection based on what your blood sugar readings are. Bottom line here is deciding that with the endocrinologist or your prescriber what the best treatment regimen is for you, and also just to not to increase or decrease your doses based on what you eat on your own without having been educated on how to do so or being trained on how to do so. Next. So just to summarize, like I said, type 2 diabetes, or like we mentioned, it's a very manageable disease, although it's very complex, it's very manageable, but untreated type 2 diabetes or delaying treatment can cause the medications to not be as effective and can cause your pancreas to eventually burn out, which leads to further complications. So there's many different medications with a variety of regimens. Each individual will have a unique treatment regimen that is specifically tailored to them. Being on medications works synergistically with lifestyle modifications to help you manage your blood sugar. And early detection and initiation has been shown to have better outcomes than delaying treatment. So don't be afraid to be started on medication. It doesn't mean that you'll never come off of the medication. Very often, actually, we see when patients lose a lot of weight or control their diet that they can come off of a lot of types of diabetes medications.
Exactly. And all the time I see members that are fearful to go on like a metformin just to give a little booster to help with that insulin resistance. Sometimes people, sometimes people are trying to actively lose weight. And for some reason, it's just not working. We're doing everything. We're looking at the diet. They're sleeping well. They're exercising. And this is a small percentage of the population, but still, you need to sometimes go on the medication to give that little boost to a lot for the weight loss. And then once that weight loss goes on, and then we sustain it and we stay consistent with it, it's not a be all end all. You get, prescribed metformin and you're forever having a prescription. And you heard it from the pharmacist and myself now.
Absolutely.
And stuck again.
That's it. So yeah, I just I hope you found this information helpful. I know it's a lot of information shared in a short amount of time, but if you have any questions or you want to further discuss your current medications, you're more than welcome to reach out to me, and my contact info is there on the screen. Thanks again for allowing me to join on this webinar, guys.
Thank you, Lila. You provided such a great overview. And guys, I'm going to also have Lila's information at the end of the presentation as well. She's one of our on-staff pharmacists, and she's available during your monitoring visits too, if you have questions. Thanks, Lila.
And remember, this is being recorded, so if you do have to go for whatever reason, that's fine, but we're just going to keep on going.
Keep it rolling. So we wanted to put these ranges up as reference. I know many of us may or may not be checking our blood sugars throughout the day. Just for time's sake, I want to make sure you guys have this available, but some key numbers to be aware of. If you're a pre-diabetic, you want to be aiming for your blood sugar less than 100 fasting, diabetic under 126. That A1C, that magic test, that 3-month average, to be deemed in control as a pre-diabetic, we want to be under 6%. And as a diabetic under 7, but that's to be deemed in control. Pre-diabetic, ideally, you want to be aiming to get below 5.7. That would be considered within normal limits. So just a quick overview, do's and don'ts of nutrition with blood sugar. So we want to pay attention to our portion sizes, of course, right? We want to try to increase our physical activity, as that's going to burn a lot of that excess sugar off. We're watching those portion sizes because we want to, as much as carbs are our friend, they're not the devil. We just want to make sure we're having them in the right quantities, and we want to make sure we're having other nutrients, that balance concept of like protein, carbs, and fat all together to play a role to feel full, but also to take up space in the diet to allow for proper portions of carbs. We want to limit our intake of added sugars, of course, right? But not to say that fruit is something to stay away from. Fruit is fine, and we'll get to more about that later on. We want to manage our stress, manage our sleep. We do not want to cut out healthy carbs and see them as the devil, because they're actually what's going to help us to modulate our blood sugars and get that fiber that's going to act like a netting to slow down that digestion and absorption of sugar. So fruits, vegetables, whole grains, and yogurt, and even beans and legumes have carbs. They're important to take in, because if we don't get enough of those good carbs, we're likely to crave refined carbs as the most simple form of energy to break down and utilize. That's that white sugar, that white bread, sweets that don't really make us feel full and are easy to overportion. This bullet here, we don't want to rely on sugar substitutes like Splenda, but we also don't want to convey that they're bad to have either. If we're having coffee with 3 packets of sugar in it, and we can get it down to 1 packet of Splenda and 1 packet of sugar, that Splenda is not going to be long-term a major issue, but we don't want to be cooking with Splenda and consuming, say, a half a cup of Splenda in our oatmeal in the morning, for example. It's just like anything, balance, moderation. We don't want to, sometimes we see this often in our population. of individuals just trying to exercise away a poor diet. It will catch up. We can't exercise away a poor diet. And I'm just going to leave it at that. Intermittent fasting can be a great tool for some, but for some it can be very triggering of larger portions in the evening. And if we are a diabetic on different medication regimens, as Lila had stated, skipping meals can be problematic, as we can end up going hypoglycemic and then eventually hyperglycemic when we have a meal later on in the day. So this is just a great guide. It's the Lower-Carb Bullseye Food Guide. It's created by Dr. Josephine Connolly over here at Stony Brook. You want to see the way that the pie is cut and look at that as in terms of the percentage of what it should take up of the diet, right? So you see the carbs, like the fruit has a star, the vegetables have a star, the grains and starches have a star, and the milk and yogurt. Milk and yogurt's also protein. That's that kind of funky group, right? But you see how that makes up about 50% of the chart. Carbs are meant to take up space in the diet. And if we're not getting enough carbs, sometimes what else will come in? Excess fat. And let's talk about heart disease, right? Or excess protein. And everyone wants to look at protein as this golden macronutrient. And it's great, but so is carbs, so is fat. And if we're eating too much protein, guess what? We go through a process called gluconeogenesis, which is where we take protein. We can't take those amino acids, that simple breakdown form of protein, just like glucose is that simple breakdown form of carbs. We have no storage place unless we have muscle growth going on and we're exercising a ton and we have to, put it to that. Once the body reaches its needs of protein, it's going to get metabolized to that of a carbohydrate. So being mindful of our protein portion sizes and in general, of course, everything in moderation. The foods on more of the outside, the red, there's no good or bad foods. We're not telling you never eat those foods, but save those for special occasions, going out for ice cream with the family, Thanksgiving, social splurges. I'm not going to sit at home on tonight and eat a whole bowl of ice cream by myself, because what's that going to do? I'm going to feel like crap after. And it's not going towards something with loved ones and sharing food with love. Yellow is those foods. Yellow and green are both everyday foods, but of course we want to choose more green than yellow, of course. Next is that USDA MyPlate. With diabetes, of course, there's a lot that goes into it. We have a lot of resources on our WTC nutrition website that can be found at the link below, or by going to the wellness support section on your WTC Stony Brook website. It links it there as well. This is just a general guideline for making a healthy plate. In general, we want to make 1/4 of the plate that protein. Like I was saying, we don't want to overportion protein, but it's essential to have that at meals. Typically, a good guideline is to aim for at least 20 grams of protein at a meal. And I'm saying at least, right? Typically aim for sources that swim, fly, or grow from the ground, right? And are about the size of our palm. So that other 1/4, that starch, this is what people get a little tricky with, right? Beans and legumes, they're protein, but they're also a little starchy. They can flex in both those spaces, and in counseling, we can get more in depth with that. Whole grains.
Guys, I recommend, if you're not sure how much carbs you need in a day or how to break down your meal, set up a consult with us. We'd be happy to individualize this for you, just so that we can get to more, of the presentation.
Absolutely. So 1/4 of that other 1/4, you want it to be a starch, right? And this is where it gets a little tricky. So like I was saying, beans and legumes, whole grains, but also starchy vegetables fall on that plate too. So starchy vegetables are like peas, corn, potatoes, sweet potatoes, and squash. Not all squash is the same, however. So your spaghetti squash, zucchini sometimes gets roped in there with some spaghetti squash. Those are non-starchy. So those vegetables, the zucchini, the summer squash, and the summer squash are non-starchy, and all the other vegetables that I didn't say are non-starchy. You want those to be that half your plate. And if we're having, say, a sweet potato, then we're not going to have a slice of toast, for example, or some pasta, or we're going to have a half portion of each. The reason why balance, that cliche term, is so important, and let's get back to why that's important, it has to do a little bit with our glycemic index. So the higher the glycemic index is, the more likely, the faster the body is going to break down that food to sugar and suck it up into the bloodstream and spike the blood sugar nice and high and make us go high for a little bit and then crash really, really low. And we want to avoid that. We call that mountaintops when we want little hills and valleys, right? So the lower glycemic index foods are going to take more time to digest, absorb, make us feel full. So it's good for weight loss too, and blood sugar regulation. So in counseling, we like to talk about things that are going to be 2 birds, 1 stone. A lower glycemic index is going to be good for most anybody. So those slower absorbing foods are going to be higher fiber foods, foods rich in fiber, protein, or healthy fat. So you'll see here on the left, the beans, the nuts, the unsweetened yogurt, cheese, whole fruits and vegetables are examples. Of course, proteins that swim, fly, and grow from the ground are also lower glycemic. And our higher glycemic foods are going to be foods that have been stripped away of that fiber, right? Those more processed foods, those foods that are more pumped with sugars and added sugars to, be aware of. So let's isolate carbs and this glycemic index right now. So on the far left-hand side, you're going to see, and I don't like to say good and bad, but for lack of, better terms right now, let's say the more optimal carbs on the left are more good carbs, fruits, vegetables, whole grains, beans, and legumes. The higher fiber carbs we want to aim for, because if we're not getting enough of the foods over here on this left side of the spectrum, we're going to end up craving more foods over here on the right side of the spectrum that now have been processed. The fiber has been stripped away. A lot of the nutrients have been stripped away. So they end up being more energy dense, right? Calorie dense, but nutrient depleted. Where on the other end of the spectrum on the left, they're nutrient dense. Like that's where we want to get a lot of those vitamins, minerals, phytonutrients, antioxidants, you name it, fiber. But they're also what? Low in calories too. So now we have our carbs though, right? We want to go over pairing because every carb needs a friend. So of course, the red line, that big mountaintop on the left that's saying apple juice next to it, here if you could see my cursor, those are the foods that are going to get absorbed very quickly into the bloodstream. So let's talk about sugar-sweetened beverages. No fiber, no protein, no healthy fat. So that's just getting dumped into the bloodstream for drinking it all throughout the day without, or sugary coffee, for example, without anything else to really bind to it. So it's going to go in really quick, go up, and crash back down. When we crash back down, we feel kind of like crap. And then what happens? I need a pick-me-up. Let me go get another Coke, or let me go get something else to eat, right? So that's when the meal timing can go awry, or if, say, we don't get something to eat and it goes to the next meal, then we're going into that next meal even hungrier. And the hungrier we are going into that meal, we are more prone to eat faster and have bigger portions. So it's imperative to now see the apple, right, to have fiber. But an apple in itself is not going to hold you over very long, right? And it's only going to bring the blood sugar spike over so much and bring it down a little bit. So if you pair that apple, say, with protein or healthy fat, or a complex carb with fiber with protein or healthy fat, now we're mitigating that blood sugar spike. It's going to cause that slowdown of digestion. And now that sugar is more so pitter-pattering into the bloodstream over a longer period of time that we have to burn off versus just dumping it in. And now our pancreas has to rush and freak out and secrete insulin. And now the blood sugar is going up. And then the liver is going to have to try to store that sugar. And that's when we're at risk for fatty liver. So at the end of the day, give your carb a friend and pair it with some protein, healthy fat, right? So for example, nuts and seeds, peanut butters, nut butters, or seed butters, low-fat dairy, for example, turkey. You get the gist. We have examples on the website for healthy snacks as well. Next, what is a serving of carbs and how many should I consume? So just to give you guys a preview, the next slide, I'm going to go into the exact carb portion sizes, but something to be conscious of is servings and portion sizes are two different things, right? So a serving of a carbohydrate is about 15 grams, right? And that's a standardized slice of bread is about, give or take, 15 grams of carbs. So now you can put a metric to it, right? To say about in a snack, we want to have 1 to 2 servings, or a portion is about 15 to 30 grams of carbs, right? 1 to 2 fruits, or a serving of vegetables with some dip and some crackers, right? So that's 2 servings right there, vegetable and some crackers, right? So that's going to be about 30 grams of carbs. Meals, we can aim for 30 to actually upwards to 60 grams of carbs, believe it or not. But mind you, everything comes down to the quality of the carb. If it's 60 grams of white rice, no. There's not a lot of fiber, and especially if it's by itself. But if it's 60 grams of carbs after an intense workout and it's fruits, it's vegetables, it's whole grains paired with protein and healthy fat, now we're talking, now we're cooking. It's all about what I put into my body is going to become me. It's going to become my organs. It's going to become my skin. It's going to become my eyeballs. I want to build myself out of the best possible ingredients. So if I'm not putting that fuel into the tank, my body is not getting built off of the best possible nutrients. So it's just something to consider. It's the quality of the food, not necessarily the calories or just tracking your macros.
And
so
again, we can help you guys meal plan if you're having trouble.
Yeah, I'm going to do a wrap up at the end, Katie, with the services that we offer. So what if you don't have a label? And we're going to go into label reading and you don't have those grams of carbs in front of you. And you want to know what the heck is 15 grams of carbs? These are all examples of different foods that are about 15 grams of carbs. So for fruit, keep it simple. A banana is not the devil. It's 2 servings of fruit. So we got to just remember that it's 2 servings of fruit and we got to pair it with protein, healthy fat. So if I can have 2 to 3 servings of fruit, like most general people a day, I'm going to make sure that if I have a banana, then I'm only going to have 3/4 of a cup of berries later on in the day. I'm not going to have berries and pineapple, right? So 3/4 of a cup of cut fruit is typically the general standard, right? And then, of course, like 1 medium orange, 2 clementines, a full apple, etc. When it comes to grains and starches, that could be the trickier one. So, of course, a slice of white bread. But one to really highlight is bagels. And I'm not trying to create a food phobia. Eat a bagel once a month. It's fine. It's not going to kill you. But just remember, it's 3 to 6 slices of bread. So imagine if we're having a bagel every day in the morning. That's one thing that we can tweak that will likely lower our blood sugars. To maybe having 2 slices of whole grain bread, right? So now we're going from 3 to 6 servings to 2 servings. And it's all about, these servings may look small, right? Like the half a cup of oatmeal, that's not going to fill me up. But remember, pair it with something. Put that half a cup of oatmeal with maybe some peanut butter, some awesome pumpkin seeds. Put it with some fruit, some fiber that's going to also bind with it, and then maybe even a little protein powder. Now we're talking, now we're full, and that's going to hold us over from breakfast to lunch, right? If we're just having a half a cup of oatmeal, I'm going to be eating my left hand by 10 o'clock. And then with dairy, that's the funny category because it is also protein. So your Greek yogurt has carbs, but it's also going to count as a protein. So you don't have to go pairing it per se, but it's a great food to add fruit to as well, or nuts, etc. Understanding the food label. I'm going to isolate on carbs right now just for time's sake, but like Katie says, we're here for you guys. Just don't hesitate to reach out. Total carbs, right? So this is where we're looking at, is it those 30 grams of carbs, the 2 servings, the 1 to 2 servings of carbs? Is it that 3 to 4 servings of carbs? We're looking here at the label. All carbs, the point to drive home, isolating from fiber for the most part, that's your net carbs. So the carbs that are going to break down to glucose, you typically do 37 minus 4 was at 36, 35, 34, 33. So that's 33 net carbs. So even though you see 12 grams of sugar, that's going to be 33 carbs that are going to likely break down to glucose. That's not a bad thing. That's okay. But we have to be mindful of the total number of carbs. And if I'm looking at this food label, there's not a lot of protein, but there is some fat. So it's going to bind a bit, but maybe I want to put a little something else with it, especially if it's a meal. Fiber is your friend. You want to aim for as much fiber as possible. And this percent daily value section, if it's something you want to have a lot of, you want to bring it more towards 20%. If it's a food like sodium you don't want to have a lot of, more towards 5%. And the little rule of thumb is 5 is fine, 20 is plenty. Because there's going to be give or take some foods that are higher and lower options throughout the day. So it's a good range to aim in. Total sugars, for the most part, with most foods, we say try to stay in the single digits. And a really important visual to drive home is 4 grams of sugar equals a teaspoon, right? So if we're having, say, a Coke, and it's about, say, let's say 56 grams of sugar. If I do 56 divided by 4, that's going to bring me to 14 teaspoons of sugar. So sometimes it's good to give ourselves that visual to say, oh, wow, that's what I'm taking in. Maybe I should, sometimes it's okay to go towards diet if it's a quench, you're trying to quench a thirst. It's not a good routine everyday food to go towards diet products as they're very processed. But we also need to, think about what we're pouring into our bloodstream as well. Some recap and some general information that's important. Everybody, we should be trying to get our blood sugars under 100 milligrams per deciliter fasting. Because if we're diabetics, we're aiming to be pre-diabetics, and then therefore After that, within normal limits, same correspondence for pre-diabetics. Other important labs, though, because remember what I said, and this is so key, is if we have diabetes, we are 2 times more likely to be at risk for heart disease. So other important lab values is cholesterol, triglycerides, and blood pressure. And where I want to drive this home is, and why heart disease and blood sugar are so heavily linked is, like I was saying earlier, sugar, glucose, same thing. It's a crystalline structure, right? Let's picture it like a little piece of glass, right? And I don't want you thinking there's little pieces of glass going throughout your bloodstream, but just for the metaphor's sake, that sugar can scratch at the inside of your blood vessel, right? So now we have a little cut. What happens when we have a cut? We have our white blood cells. They're our police officers, just like our HDL cholesterol. And they're going to go to the site of that injury and they're going to try to patch it up and clean it up. What happens when we have a cut? It turns to like a scab, right? What are scabs? They're a little tougher, they're a little harder, right? So now that blood vessel is going to be a little less bendable, and now it's getting a little rougher, right? And that's what can potentially lead to a clot, right? Because in atherosclerosis, that hardening of the arteries. So that's how blood sugar gets really linked with heart disease, because now there can be something disrupting the flow of that blood, that transport throughout the body. And then let's add in, big pieces of fat like triglycerides or cholesterol circulating into the bloodstream. And then on top of it, if the salt's high or our blood pressure's high and the heart's pumping really hard to push all those ingredients, those pieces all throughout the body, right? We got to get that, the cholesterol's moving through, the trigs are moving through, but now there's a little bit of blockage. We're more at risk for different heart complications like a stroke, for example. So it's just something to be very mindful of and aware of. Absolutely. If there's one thing we can do is cut down on the sugar sweetened beverages. All foods are good foods except for sugar sweetened beverages. I hate to say it.
I agree.
Yeah. If there's one thing, please, for the love of God, don't drink soda every day. And then choose lean proteins. Do they swim, fly, grow from the ground? Awesome. It's okay to have steak from time to time. All food is good food. Try to keep it in moderation 2 times a week or less. It's going to be good for our heart and our colon health. Eating healthy fats is going to help to reduce inflammation in our body. Think Mediterranean diet, think nuts, think seeds, think avocado, think olives, olive oil, grass-fed dairy, things that come from the earth, not ultra-processed hydrogenated oils or high fructose corn syrups. Avoid going too long without eating. Eat every 3 to 4 hours. If I can't stress this anymore to people, I noticed during the pandemic, we all lost kind of like a meal structure. Eat breakfast, lunch, dinner, and 1 to 2 snacks. Because if we're skipping breakfast, then we're going to be super hungry at lunch probably, and we're going to be more likely to increase our portions. Or if we have breakfast, skip lunch, and then go straight to dinner, well, what's going to probably happen when I see a recall like that, I already know that patient is very likely nighttime binge eating because they're not getting the calories earlier in the day. So give yourself permission to have food. Food is not the devil. Eat it. It's good. It's supposed to nourish you. Work with us, work with your MD, work with your RD, work with your pharmacist, work with your medical team. We're here to help you. We provide completely free, let me say that, one-on-one counseling for all members here at the WTC Health Clinic. So we cover 9/11 and non-9/11 conditions. Everyone thinks dietitians are just weight loss. We help you with your GERD. We help with weight. We help with IBS. We help with your blood sugars. Utilize us. If you have a question, you're not obligated to book an appointment. Just call us. We're here to help. Aim for breakfast. Breakfast is that funny time period where I really would like you guys under 30 grams of carbs. I know at meal times, like I was saying earlier with lunch, we can go higher, like 45 to 60. Breakfast, our cortisol spikes high, and that's already a stressful experience. We have to wake up, right? So that blood sugar's going higher, that cortisol is going higher. We can't facilitate as much carbs if the blood sugar is already going higher. So trying to keep under 30 grams is ideal. Aim for snacks, like I was saying earlier, 15 to 30 grams of carbs. Every carb needs a friend. Pair your carbs with protein, healthy fat, please, for the love of God. Meals will vary, but can range, of course, like I said, 45 to 60 grams of carbs for more like your lunch or dinner. But again, not just a plate of rice and beans. We have to have more fiber, more protein to bind with it. And I know today was a mouthful, guys, so I really appreciate you guys sitting through this and being so patient. Does anybody have any questions? We're here for you.
I know everyone's microphones are turned off, so I don't know if anybody wants to unmute themselves. Feel free at this time.
Yeah. Yeah. Or you want to put it in the chat. You can always email us too, guys. So aside from
I
these
think Wade had a question.